What are some questions to ask before treating scoliosis? General practitioners or general physicians or general chiropractors or physical therapists can treat people with scoliosis. But that's not the same thing as treating the scoliosis itself. That requires really specialized training. Those who choose traditional treatment are typically funneled towards surgery, meaning that as they choose traditional types of scoliosis options, normally they're told to do things that are going to really funnel patients towards more of a surgical type of approach. So surgeons treat scoliosis in those cases. But choosing a less invasive, non-surgical option can be a little bit challenging in terms of finding out who should you use. And to receive the treatment from a specific scoliosis-trained doctor or scoliosis-trained chiropractor can require a little bit more investigation. And really choosing your treatment approach, whether it be an invasive or surgical type of treatment, or looking at a traditional type of option, or choosing a traditional or non-traditional option, like a more conservative approach, can really be one of the biggest decisions that you ever make regarding your scoliosis outcome, or in terms of what you're going to choose. Because whether you're choosing a more traditional approach or conservative approach, they're going to lead to completely different outcomes. So there's some really 5 important questions I think every patient should really be asking their providers. And really the most important one, I think, is scoliosis really your primary focus. For many chiropractors, doctors, physical therapists, scoliosis is one of many, many things they treat, and it's not really their main thing. They don't specialize in scoliosis. It's not 100% of their treatment focus. It's not what they're specializing in. Scoliosis is a very complex condition, and it's a progressive disorder that worsens over time. So if you're wasting time getting treated by a method or a treatment process that's not designed to reduce scoliosis, normally the curve is going to progress and you're going to have a worse outcome, because as the curve worsens, it's harder to reduce. Only really somebody who understands scoliosis specifically will fully understand the pros and cons of all the treatment options and try to get a reduction in the scoliosis. So therefore, finding somebody that spends majority of their time, 90% of their practice time focusing on scoliosis is by far one of the most important answers you want to look for. Second question would be is what types of treatments do you use in terms of treating scoliosis? Many doctors or many therapists, they'll use only one treatment, meaning they will do only exercises, or they'll do only therapy, or they'll do only bracing, or they'll do only chiropractic care, or in fact, many conservative doctors or traditional doctors, only do watching and waiting. They'll just watch, or maybe just use traditional Boston braces. And then when they don't even use the brace, they'll send you to somebody else to get the brace made, and then you bring the brace back to them. Or maybe they'll just be surgeons and just do surgery. So finding somebody who actually uses more an integrated approach that can use many different types of things, integrate chiropractic care, integrate physical therapy, integrate corrective bracing, integrate scoliosis-specific exercises, isometric exercises, and normally you want the doctor that's going to be coordinating all those things to make sure they all work properly. I always kind of say conservative approaches tend to be very fragmented. You go to a physical therapist over here, you go to an exercise physiologist over there, go to a chiropractor over here, go to an orthotist over here, and nobody's really working together to make sure all these things work together. So at Scoliosis Reduction Center, we try to integrate all these approaches into one treatment process for the very best potential outcome. Another good question we ask will be is, have you seen cases like this before? It's funny that this question doesn't get asked more often, but this really reveals a lot about the provider, and really have they treated somebody like your case. And if they haven't seen cases like yours before, or something similar like yours before, normally they're not going to be very effective at treating it, because you're going to be the first person that you've ever seen with this type of condition. And especially when it comes to more severe cases at 25 degrees or greater, 40 degrees or greater, 50, 60, 70 degrees. Unfortunately, the largest curve I've ever seen and treated has been 155 degree scoliosis, and I've seen everything in between. So therefore, looking at how severe curves become and treating more severe curves require definitely more expertise. But looking in terms of if that person had seen your case before, this also gives you an idea of how much they focus on your particular type of problem. And then, of course, the follow-up question to this is, what was the outcome when you treated a similar patient? And this is very, very talks about how well their treatment success is, be able to see or understand that there's many, many positive outcomes. If a provider has had multiple treatment success stories, they have lots of pre and post x-rays, lots of pre and post posture pictures to show that, hey, this treatment is successful, we get results with this, well, therefore your option is definitely looks better in terms of better treatment option than somebody who says, well, I don't have anybody to show you like this, or they don't have no stories to show you that this is where they ended up well. In addition, ask them that what are their failure rates? Like, okay, what was their outcome? How well, all the ones that did well on, but what's the likelihood of it not working, right? Also, a good question to ask would be what is the goal of your treatment approach? Like, what's the physical goal? And in this question, I'm also surprised that most patients don't ask, because a lot of traditional treatment options, the goal is just not to have surgery. Maybe like the curve doesn't progress to be surgical. So you can start off with a 25-degree curve, progress to like 40 degrees, be below surgical level. You worsen, but it's considered successful because you don't have surgery. Where our definition of success is that your curve is less than when you start, right? So the goal, some doctors say, well, the goal, we have the least invasive surgery possible, where other doctors could say, well, our goal wants to be less than when we first start, or prevent surgery completely. So the goal of the treatment when you're walking into it is also going to help determine the results of your treatment. In fact, a lot of other traditional types of conservative treatments, like conservative bracing, that kind of stuff, the goal is just to slow down progression. So goal to either reduce curves, prevent surgery, minimal type of surgery. So these are questions you want to know to make sure they align with your goals, because different approaches have different goals or end goals in terms of the results for that patient. So never be afraid to really ask questions regarding the provider that you're choosing before you really commit towards one provider in terms of treatment options, and make sure those questions are answered in a way that you feel that they align with yourselves, because the treatment option that you choose for your scoliosis can have lifelong consequences, especially invasive ones like surgery. Make sure that this is something that you feel comfortable doing, if that's the way you're going to go. And if you're not, if you're going to choose more conservative approaches, make sure you're choosing somebody that's going to produce the results you want. Because again, these can have lifelong consequences, because we know scoliosis is uncurable. You're not curing scoliosis. You're not getting rid of scoliosis. You're managing scoliosis. So you're either managing it conservatively with exercises, therapy, rehabilitation, or you're managing it surgically with rods and screws. But one way or the other, you're managing it with it, and you're dealing with the consequences of these decisions really for the rest of your life. Here at Scoliosis Reduction Center, I'm really happy, and I take a tremendous amount of pride in how much time I educate patients on our treatment process and how we believe it's one of the most effective treatment processes out there. In fact, most of my patients, I spend anywhere between 45 minutes to about 90 minutes just discussing our initial findings and how we go about treating their problem and answering all their questions to make sure they're understanding what our goals is and how it aligns with their goals. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.